And with our follow-up question. Okay, all set? Good afternoon. Today we are announcing new requirements for higher education in response to the increasing COVID pandemic on campus. We have certainly learned some lessons regarding the return to campus instruction and off-site instruction. And we've seen a significant increase in the COVID infections around congregate living quarters and social gatherings, particularly around our fraternities and sororities. We still believe that education can go forward safely, but that is only if we have some additional safety measures to protect not only students, but the larger community and their families from this pandemic. We have made it clear to the Greek organizations that this is a serious issue, not just for themselves, but for the wider community. And we do have a fair expectation that students will step up to the plate and take some responsibility for this. We simply have to address this issue. It is too raging. And so we're taking these steps today to increase the safety at these sites. We need to make sure that all of our bright, young, promising students do their part to keep themselves healthy and everyone else around them. I'm joined today by Department of Health Deputy Secretary Lacey Fehrenbach, as well as Washington Student Achievement Council Executive Director Mike Miotti, to answer questions a little bit later. So we know we have seen a real surge in the pandemic around our colleges and universities. To date, we have seen fully 35 outbreaks at colleges and universities, with more than 800 cases directly attributable to these congregate living and social gatherings associated with campuses. So this proclamation will do the following. It will require masks at all times in living areas on campus, except when outside or in sleeping areas. Congregate sleeping porches will no longer be allowed, and no more than 2 residents are allowed to share the same sleeping area. Visitations need to be limited to 5 people from outside the same household, and common areas can have no more than 5 people in them at any given time. So, in other words, we can only watch the Apple Cup on these sites with 5 of your closest friends. And when we do that, and this is really maybe the most important thing here, when we do watch the Apple Cup, we just need to socially distance. We need to wear masks, even with our good friends, because those are the settings that transmissions are occurring. And this is a fatal disease now for over 2,000 people. So in order to provide some protection, we're also requiring that colleges provide isolation and quarantine facilities to fraternity, sorority, and other group houses. And students who live in shared housing in close proximity to campus, and students living in dorms and personnel if they don't have a place to go. Students could be charged for the costs associated with that on a sliding scale. Now, institutions of higher education that don't have residential facilities, we still need them to develop a plan to provide for the isolation and quarantine needs of their students who are unable to isolate or quarantine in their usual residence. So they need to work with their local health authorities on a plan for that. Consistent with this, it's common sense that we need to make sure that meals on campus need to follow current guidance, which is meaning you have grab and go, or you set single tables to avoid infection while dining. We just got to get these outbreaks under control. And I want to reiterate, we care about the students. They have incredible futures in the state of Washington. But we care about their family members, their fathers and their mothers, their neighbors, their fellow churchgoers. And we just need to act here. A comment about our current situation with the pandemic. These additional restrictions are important, not just because we've seen COVID activity increase on campuses, but because we're seeing the same trend of increase in activity statewide, nationwide, and in some sense worldwide. This threatens our health, our businesses, our children's education, our livelihoods. So we need to get it under control. It's a part of a phenomenon called fall, of people coming inside, letting down our guards, and having the infection take off. Since I issued the Stay Home, Stay Healthy proclamation in March, we have come a long ways. We have knocked down this infection, big time. Our decisions have been backed by science. That's why they have been successful. But to mitigate the spread and to allow us to get our economy to get back going, we've got to continue this effort. And I think there's sort of a second front we're opening now in the effort against COVID, and that is we really need individuals to follow health recommendations. We've made some good decisions, and business leaders and organizations have taken responsibility to encourage people to socially distance in their business, to wear masks, and that's been very effective. But now COVID outbreaks stemming from private social gatherings are contributing to this spike in the pandemic in our state. Statewide, we are now averaging 100 cases per 100,000 residents for every 2 weeks. This is 4 times higher than our goal. So what this boils down to is that this needs to be a matter of all of us being involved in this effort on a personal basis to help our entire community. And frankly, this is a challenge. We ought to understand this is not easy work. And it's not easy because we tend to feel safe in our own environments, in our own homes. We feel certainly non-threatened when we're with our friends that we might have known for 40 years. But what we're finding is people, even when they go into small groups and spend time with people in close proximity without masks, we end up having increased COVID transmission. So what we have to understand is that COVID-19 can penetrate any social bubble with enough time and without adequate preparation. People have now spent most of 2020 under these precautions, and we certainly understand how long this has been. We're all tired of this virus, but this virus is not tired of us, and we've got more work to do. This outbreak on college campuses really, I think, could be instructive to us as a lesson. It doesn't matter where you are. People in places that are well known are not necessarily safe. This virus doesn't care who you are or what event you're at or where the gathering is, whether it's a football game or a celebration at the White House in the Rose Garden. There still can be danger for people who are too close and who are unmasked. It applies to all of us, every citizen. We've had elected leaders in D.C. who've had political events who've been affected. The former governor of New Jersey, Chris Christie, went up to one of these events. He got the COVID at a super spreader event, spent time in the ICU, and we're very appreciative that he has recovered. We're all happy about that. And he has indicated that he thought it was a mistake not to wear masks. So these are things that we hope remind us all of how we can be effective in protecting ourselves and our loved ones, and how we are vulnerable even in the safest, what seems to be the safest circumstances. So wherever there's a gathering, this is now an issue. Many of us have the technology to continue these gatherings remotely. And for gatherings that are in person, I hope you can consider keeping them small. Meeting outdoors is best. Meeting with open windows, second best. If you're inside, distance works, and masks work inside, even in homes. So we hope people will think about this as we continue to fight this pandemic. We want to open our economy. I want to have a comment about a concern we have in the middle of this pandemic. I'm very concerned that the Republican Party in the U.S. Senate are rushing through a Supreme Court nomination that could put the entire Affordable Care Act at risk. This would deprive millions of people from accessing health care. I joined Insurance Commissioner Kreider last week to highlight what this means for our state, and it is very, very concerning. If the Affordable Care Act were overturned by the court, 750,000 Washingtonians would lose their health insurance. And the state would lose more than $4.2 billion in annual federal funds. And this is important because it affects so many people who really don't get their insurance just through the Affordable Care Act. It would also mean that people with pre-existing conditions, cancer, heart disease, arthritis, and those who've had COVID could once again find it virtually impossible to get affordable coverage. So during these times of anxiety, Washingtonians should not have to have the increased anxiety of losing their health insurance. And this is happening in the same United States Senate that has not passed a real COVID stimulus bill to help our state more than 200 days. So they need to hear our voices to help them understand, don't take away our health insurance, do help our state be fiscally sound. Lastly, we're 2 weeks away from the most consequential election probably in my lifetime. And most Washingtonians now have their ballots, regardless who you are or who you're for. So we hope everybody makes a plan to get your ballot in. We want to count all those ballots, no matter how they're cast. So with that, happy to stand for your questions.
First question comes from Rachel with AP.
Governor, how is the guidance on masking and gathering size limitations different from those that already apply to everyone else? And how confident are you that the universities will do a better job managing fraternity and sorority outbreaks now that they'll be required to provide isolation and quarantine facilities?
Well, first off, I would say this is a direct requirement that the state of Washington is requiring this of these facilities. So it's administered not just through the universities, it is a direct requirement of the government of the state of Washington. And we have numerous enforcement tools should those become necessary. The isolation part is a requirement for the colleges to assist in the isolation, to make sure those isolation capacity is afforded to people, even if they live off campus. They do have the right to charge the Greek facilities for that, but they need to have a plan to help provide quarantine for their students. There is a difference between in the college system and some of the sleeping systems that are different than some of the other congregate settings. But we have done extensive review, and we think that this is appropriate and necessary given the very extensive outbreaks we have suffered. And this is not to pick on Whitman County, but we saw a huge positivity rate in Whitman County, principally related to this. They got hit first because they opened first, not because of any particular inability, but they just opened first. And unfortunately, we have seen the same thing play out on other campuses. So we think this is well tailored to the circumstances of college students and colleges. And again, I want to reiterate, there's this sense that it's only about the students. It's about everybody. Because when you get this big outbreak in a fraternity, it just can spread to the larger community. Anytime those students go home, anytime they go shopping, anytime they go outside. So this is a community problem stemming from some of these congregate living facilities.
Rachel, would you like to ask a follow-up?
Yes, on a separate topic, California's governor announced yesterday that his state won't allow any distribution of a coronavirus vaccine there until there's an independent review by the state's own panel of experts. Is anything like that being considered here?
Yes, we are considering the right way to have an independent review. We're talking to some research facilities about that. It has not been determined exactly how or how to manage that process. But we will want to make sure that we have confidence, because we have to have a high enough percentage of people to actually take the vaccine to make it effective. Now, to be honest with you, the reason for the necessity of this is pretty clear. And the reason is we've had a very unfortunate multiple events of the president trying to, for political purposes, rush the approval process. As a result of that, people's distrust of the system has increased, something like by 15 or 20%. So it is because of that that you've seen what California has done, and we're heading in the same direction to have an independent review so that we can assure our public in Washington that good scientific decisions have been made. Now, having said that, to date, I think we have seen high quality of integrity of this process. We've seen the manufacturers be transparent in their protocols like they've never done before. We have seen them pausing their trials when they've had an adverse event, which is in effect a good sign because it shows they're paying attention and not just ignoring speed bumps or something that could be worse. That's a good sign. We've seen a good sign that some of the federal employees have pushed back against the president and said, no, take your hands off this process. So there's some good things happening that should give us increasing confidence against the corrosive impact of Donald Trump trying to politicize this. But yes, we will have a way to give people confidence in this system here in Washington State.
Next question comes from Joe at the Seattle Times.
Governor, given the upward trend of coronavirus cases around the nation and here in Washington State, are you considering any additional wider restrictions in the coming weeks here?
Not at the moment, but this is an iterative process. We have to adapt. We look at the numbers every single day, and we're going to make the best decisions we can, but there is nothing in the immediate offing. That is not to say that we're not concerned about these increasing numbers. Now, excuse me if I'm a little repetitive here, but what we think we're experiencing we have experienced is profound success in the business, in the retail, in the industrial sector of knocking these numbers down. As you've heard me say this before, we've knocked them down as much or almost as any other state in the United States. I didn't check this morning, but a few days ago there were 45 states that had more infection than we do. One state had 10 times as many infections per capita as we did just a few days ago. So we've experienced really good success in the environments outside of our home, where we go to work, where we go shopping, when we go to medical facilities. But now we think what we're seeing nationally in our state and in Europe are people coming inside as the weather cools. They are going into less ventilated areas where the windows aren't open. We are socializing with our friends who we have trusted for decades, who we don't see as a threat. We're enjoying their society and we're becoming infected. And that's an international phenomenon. And so we have to figure out a way that we can adjust some of our lives in a way that we can continue to have great relationships, close relationships, without infecting one another. And that's kind of the new challenge that we have, to help people understand how to do that in a way that keeps great relationships going. We'll be talking about that quite a bit in the upcoming few weeks.
Joe, would you like to ask a follow-up?
Given the civil unrest this year, the heightened tension around the election, lots of disinformation going around, and the high partisanship, are you concerned that we might see instances of civil unrest here in Washington State on or after the election? And do you plan to have the National Guard on call on election night and in the days afterward if they're needed?
Well, I'm very hopeful that the margins of the election will be large enough that there's not a reason for controversy. That would be a great blessing for the United States. We hope that that'll be the case. We are considering, in a variety of ways, measures to make sure that we provide security. And I think we've got a good handle on that. I won't go into any great detail about it. But yes, we are thinking about things to be prepared should that occur.
Next question comes from Keith with Como.
Hey, Governor, with the fall surge pretty much underway, are you thinking of increasing the mandate for masking to actually have enforcement of it so it's not just a voluntary personal decision?
We have not considered that additional measures, mainly because we've had really good compliance. People are complying with large numbers. It can improve, but at the moment, we're not considering additional measures like that.
Keith, would you like to ask a follow-up?
So Governor, what is the solution here since we're going on this, what looks like a third wave, or you can call it a fall surge, whatever you want? How are we going to turn the corner on this?
Well, I appreciate that question. We can turn the corner on it. The good thing, if there's a good thing about this virus, is we know how to beat it. It's really in our control, and it's almost costless, which is pretty amazing, to save lives for something we know how to do, virtually doesn't cost any money, and has science behind it. And that's to simply socially distance and wear a mask, particularly when we are in inside environments, with anyone else in the same room with us, other than our immediate household. That's like the $64,000 answer to the $64,000 question. And we know how to do it. It's like, it's totally in our control. We don't need a new college degree. We don't need a new piece of equipment. We don't even need a new vaccine. It just means we have to do what we know works, which is particularly anytime you're inside, and that might be at you're watching a Seahawk game, and if you have 6 of your friends over and you're all sitting on the couch and we're not wearing masks and we're enjoying a libation and another Seahawks 6-0 start with an MVP season for Russell Wilson coming our way. But if we're sitting close together and we're not wearing masks for a couple hours, it's just potentially fatal for people. And the reason I mention this is that is such a joyous thing to be sitting on a couch watching a Seahawks game. Hardly anything more fun. But if we can figure out a way to do that where we're spread out, and if we are going to come in close, within 6 feet, I wear a mask anytime I'm around with a bunch of other people inside. I encourage it. If we're having dinner parties with friends who we trust, and this is the insidious nature of this virus. It's just so easy to have a good friend over, to a dinner party, have 6 friends over and talk for 2 or 3 hours. And it turns out somebody was positive. You didn't know that then. Nobody knew they were positive. And boom, you've got a bunch of people potentially infected. We're having a birthday party, and you have a bunch of friends over, and boom, you got a spreader event. So the challenge is, the things that we are most comfortable with are now becoming the most dangerous, which are these social interactions in our very comfortable settings. And again, I want to reiterate, it doesn't matter what setting it is. It could be a ball game. It could be a party. This virus works in any environment. Certainly inside without windows open, it's the best for them to get you. So that's the answer. We can do it. We have done it before. We've knocked this virus down before. We did things better than most other states. And as a result, we've had a better result than most other states. So we know we are capable of doing this. We know the science. We get the science. There's no debate about the science. Masks work. Dr. Fauci will tell you masks work, and so will the prevailing science. There's no question about that. And so does social distancing.
Next question comes from Jim with the Spokesman Review.
Governor, you know that gatherings on campus are responsible for spreading the virus. How about gatherings like political rallies where people are outside but unmasked? Is there any evidence that that's spreading the virus in any parts of the state?
I don't know of a specific identified super spreader event at any of these, but we can't eliminate that has happened. The genetic coding of where this comes from, hasn't been that clear. But we do know these super spreader events can happen outside. And when people are close contact, we showed the picture, didn't we? We showed the picture of the Rose Garden. You saw that picture of the folks in the Rose Garden. And there was a whole bunch of folks in the first 2 or 3 tiers of that meeting that were infected. So it is safer outside than inside. There's no question about that. But I just tell you, I certainly would not want a loved one of mine sitting next to somebody else with no mask on for any period of time, even outside. So I am concerned about that. I think it's unwise for people to have, get-togethers or rallies even outside where you're not socially distanced and you are not masked. I highly recommend against that.
Lacey, did you want to add anything? Lacey, we can't hear you.
You may look at some of the description of the Sturgis motorcycle rally too, that my understanding is much of that is outside activity. They think that that has become a spreader event throughout the Midwest. North Dakota has now 10 times, almost 10 times the number of infections we do right now.
Lacey, can we try your audio one more time? No, we still can't hear you. We'll come back later. Jim, would you like to ask a follow-up?
Yes, on another topic, people in Stevens County are wondering when you will appoint replacement county commissioners from the list you were sent last week, and what you think about two of the positions. The choices are the same as the commissioners who were removed by a judge.
Haven't made decisions about that. I guess what I would say is soon, but I can't give you an exact date. And I won't make a comment about the individual candidates at the moment.
Next question comes from Austin with Northwest News Network.
Hello, Governor. A question about efforts in the UK to try to get kids back in school and keep them in school. And it seems like a lot of the leadership there has been saying that in order to do that, they will prioritize keeping schools open, and even if that means closing pubs and restaurants and shutting down other activities. Why not more of an emphasis in this state and getting kids back into school, even if it means restricting other parts of day-to-day behavior and activities?
Well, to start with, as you know, these are decisions that local school boards make. We have not mandated this from the state level. We have made recommendations. Our most recent recommendations in the moderate risk category is to make moves to bring back the earlier grades, particularly, and finding a way to do that safely. So we have made that recommendation, but these are local school board decisions. And we are continuing to look at the success of other schools. I've asked for actually a review to be provided me of some of the experience of the schools around the state, both public and private, that have returned, particularly in the earlier grades. So it is something we continue to look at, and hopefully we'll be able to do that as we learn more about this virus and the ability to do this safely.
Austin, would you like to ask a follow-up?
Yeah, just briefly, you mentioned that when there is a vaccine available, in order to be effective, most people will have to get it. What are your thoughts on requiring a vaccine, or along the lines of the recent change in state law and the measles vaccine not allowing any sort of personal or philosophical objection?
Well, I would think at the moment that it should be the same regardless of which vaccine it is. The same rules should apply. So I would hew to my previous position. By the way, I just wanted to add something, your question about the schools. I would refer you to our revision most recently regarding reopening schools that basically had the language that I'm referring to. You may want to take a look at that.
Next question comes from Alexis with the News Tribune.
Governor, where does the population of colleges and universities fall when it comes to priority for a vaccine? How is the state evaluating that?
I was going to make a terrible joke that I will defer. So the people on the colleges will be treated with no different prioritization than similar demographics, or neither greater nor lesser just because you're in college. So I'm not sure that I totally understand your question. There'll be no difference whether you're a 20-year-old in college or a 20-year-old in an apprenticeship. Unless that apprenticeship is in a healthcare field, in which case you may be in a higher priority. because we anticipate that people who work in the healthcare system will be a top priority with the limited amounts of vaccine we have. And by the way, this will be a challenge for us because the stocks will be very limited to begin with. So this will be a challenge for us as we go through these priorities.
Alexis, would you like to ask a follow-up?
No, thank you.
Next question comes from Hannah Scott with Cairo Radio.
Governor, first of all, or it could be for someone else who can speak to the colleges or university, I'm curious if we're doing mostly remote learning, why is student housing open at all?
Well, this is a decision best asked to the fraternities. They're the ones who, they're separate nonprofit organizations. The colleges do have dormitories. I know there's some students that do have to be on campus, and some of the scientific training they have requires some physical presence. I think that they are at a reduced. My understanding is that the capacity of dorms are reduced. Same in the Greek system, which is a part of a good decision. And maybe to make sure people have a place to go as well. But I would refer your questions to the colleges about that.
Hannah, would you like to ask a follow-up?
Yes, and this is for the governor. Back in March, I asked you about it was a minority number of people who really weren't kind of buying into the threat from COVID. Over the summer, we've seen in cases go up, but no real big increase in deaths. And I've seen the number of people who don't believe the threat from COVID increase myself, people who don't mask up and don't follow the guidance. How can you fight that at this point? What would you say?
You know, I missed the first part of your question. Your question is, what can we do about people who won't listen to the truth? Is that what the question is?
More people now don't believe in the threat from COVID than in the beginning.
Well, first off, I'm not sure that's true. I actually don't believe that's the situation. And the reason is that the number of people who accept the wisdom of wearing a mask is, you know, probably 10 times higher than it was the day we had our first death in the state of Washington. We've had a dramatic increase by many, many times of people who do believe wearing masks makes sense, and that's why we're having success. Look, we didn't knock these numbers down by accident. This was not just because we drew the lucky card. It's because Washingtonians are wearing masks by huge majorities, huge majorities. I would love to have the same electoral result as the percentage of people who are wearing masks right now. That would be wonderful from my perspective. So we are succeeding by huge majorities. Now, it's not 100%, and the minority sometimes is the squeaky wheel on this. But don't think that just because the President of the United States is trying to downplay this problem and trash talk Dr. Fauci every day and try to say that this is a mirage and encourage you to go listen to QAnon about this problem. Don't think that speaks for the Washington people of the state of Washington. It doesn't. It may be loud, it may be annoying, but it does not speak for us. We are speaking by wearing masks when we go to the grocery store. And if you go to a grocery store, you'll see huge compliance. Same with other stores. So I do think that it is not yet unanimous, but it is a huge majority and it is being successful. Well, what we need to do now is to take that success that we have displayed when we go shopping in social settings so that we protect ourselves in social settings as well as we do at the grocery store. And if we do that, and I believe that we can and will, we will be able to save ourselves from thousands of more deaths. And we have saved ourselves thousands of more deaths. If you look at our rate of fatalities and compare it to what they're experiencing in other states, we have saved thousands of lives because of what we've done already. So I feel confident Washingtonians are going to continue this effort in huge majorities.
We have time for 2 more questions. Next one comes from Jerry with the Everett Herald.
Governor, as you know, the Supreme Court has threw out Initiative 976, but I'm wondering if the voters, a majority of voters, do want the vehicle registration fees set at $30 plus those other fees. regardless of whether they live in the Sound Transit area or not, just statewide, the vehicle registration fee they would like capped. Are you prepared to support that in 2021 or not? If not, why not?
Well, just like many of the things Mr. Iman has proposed, that initiative would not have produced $30 car tabs. That was a con job. It would not have done it, even if it was not illegal and unconstitutional. That's to start with. But yes, people's frustration is abundant. We ought to recognize that. I do believe we should be open to reforming the car tab system, but we need to do that in combination with a way to replace funds that would otherwise make it impossible for us to keep our bridges from falling in the river and potholes taking over I-5 and keeping our buses running. So I do believe that we ought to look at options to reform that system, answer the frustration of people in Washington, and at the same time find a way to replace that that financial source that keeps our transportation system running. We need a way to get to work at the same time. So in the next legislative session, I think that you're going to see that kind of action.
Jerry, would you like to ask a follow-up?
Yes, I wanted to go back to this issue with the college students. There may be some who think there's a mixed message here, and the college students may be getting a break in some ways. You know, events you mentioned, the Apple Cup watch parties and probably Seahawk watching parties. That's our settings, as you said, settings where transmission is occurring. So one would wonder why you don't just take steps to prevent those settings from occurring by not allowing the University of Washington, Washington State University, to play football games this year. Cancel the Apple Cup and not let them, and thus not have those potential spreader events occur.
That would not materially change the situation. People, it's not what you're doing at the event, it's where you're sitting at the event. Whether you're watching the professional bowling organization or the Boston Symphony Orchestra or lacrosse, it's where you're sitting that is the risk. So that would, I don't believe simply having the games on TV are creating an additional risk. It's the socialization for whatever purpose that creates the risk. So we have focused and will focus our energies in helping people to understand that. And the key to that, I think, and we'll be having a communication strategy from the Department of Health to help people understand that we can have this false sense of security, that we feel very secure in our own homes. We don't consider them a risk. We certainly don't consider our friends a risk, but if we're too close to them and we're not wearing masks inside, it's a risk. And so just helping people to understand that so they can make individual decisions to protect their health is the best we can do right now. So we're going to try to help out.
And just to add to that, I agree with the governor. You know, people, we're all facing really hard decisions as human beings and families and friends as we roll into the fall, and we've been months into this social distancing. But, you know, the more people we interact with at a gathering anywhere, it doesn't matter where the gathering is, if it's in a fraternity or sorority house, if it's in your own house, if it's in your faith community, anywhere, the more we gather, the longer those gatherings are, the more people that are there, the higher our risk for transmitting COVID is. And even gathering with people you love may spread COVID-19. So as the governor mentioned, there is a toolkit available on the coronavirus.wa.gov website, and it is very easy. It's www.coronavirus.wa.gov/gatherings. There are tips for how to do game day traditions. There are tips for Halloween. There are tips for some of the holidays that we all love and look forward to celebrating coming up here in the months ahead, and checklists that you can use to plan your gatherings so that we really do this more safely. And we have that opportunity for social and human connection while we keep our transmission rates down and continue saving lives, as Governor Inslee mentioned.
We just need to think a little bit like Russell Wilson. You know how he's got 3 people coming in on him and all of a sudden he squirts around and is outside of their grasp so they can't get within 6 feet of him. We need to adopt that type of strategy. We can't let those linemen get within 6 feet of us. That's a survival tactic. We just need to be as good as Russell Wilson.
Final question comes from Sally with AP.
Hi, Governor. Can you talk more about requiring colleges to house workers who live on campus who may be exposed to COVID? Will they have to pay to stay there if they get sick at work? And what precedent does this set for public employees during the pandemic?
You know, I'm not sure if we addressed that. Lacey, could you help me on that payment issue for employees of colleges? I'm not sure we addressed that issue. And if you don't know the answer, we'll have to get back to the questioner.
I do not know for employees. For students, there is the ability to charge on a sliding scale, so we don't want low-income students who cannot afford to pay to be charged, but recognize that the universities do have some expenses to recover.
So we'll go ahead. Go ahead, Mike.
I was just going to add that the campus employee provision applies to campus employees who already live on campus, which is, you know, normally a condition of employment that they're living on campus, and so that's somewhat of a different relationship, but we can get you more details on it if you like that.
Yeah, I'll get you an answer to that.
Sally, would you like to ask a follow-up?
Yeah, Governor, can you address, what kind of precedent this sets for public employees, employers during the pandemic?
Well, I don't think we've addressed this specifically in other contexts. Are there other situations where public employees have to live at the site? We'll have to think through that. It's a very interesting question, and next time we talk, I'll have a really good answer for you.
Any final words, Governor?
No, except I owe you a couple of answers, and go Cougs, go Huskies, and go safely.